Yes, good morning everyone. Yes, yesterday we had been learned that, which means previous class, cultural shock. How to manage the cultural shock. So, which is very important for our life as well as our professional life as well as our personal life to making happiness in everyday life, whether in our home or away from home, you can keep and happy and manage the every situations. Today I have to start with hospital culture. What do you think about hospital culture? We know that culture means material, non-material, cultural factors which is determine pattern of behavior. The hospital, what? So you can make a definition for the hospital culture. Daya, Daya, Dayayam, Shinomol.
Yes, yes, sir.
Yes, Daya now. Yes, Daya, what do you think about hospital culture?
Hospital culture is the attitudes, behavior, beliefs, and expectation of organization.
Excellent, good. A nice answer by Daya is. So simply we can say that hospital culture means the culture of hospital which is determined by material and non-material cultural components. One definition available here. Because this pattern of behavior, hospital which is material, non-material cultural traits in hospital used to improving patient care. So what are the non-materials? Mainly knowledge, language, belief, values of our professions, etc. Material means what are the tools we have been using in the hospital? Mainly apparatus, BP, temperature, vital signs, as well as other, injection and drugs, etc. So these all the components determine the behavior of the professionals in the hospitals. So if material change, culture of hospital will be changed. If knowledge, skill of nursing professionals in the hospital can change, the culture of the hospital will be changed. Look at this, one of the accreditation, NABH, National Accreditation Board for Hospitals and Healthcare Providers, NABH, set the cultural standards of the hospitals. So students, this is very important organization, quality control organization in India. So nowadays every hospital having this. Mainly corporate hospital, when you go to Apollo hospitals or Fords, as well as other hospitals are available, mainly the corporate hospital maintaining record this like this. First one, access, assessment and continuity of care. Second standard, care of patients. Third one, management of medication. Fourth one, patient rights education. Fifth one, hospital information and control. Hospital infection control, HYGIENE. Then organization center standards. So first one is patient center standard. This is organization center standards. CQI, continuous quality improvement. Seventh one, responsibility of management. Eighth one, facility management and safety. Ninth one, human resource management. Human resource means mainly doctors and nurses and develop human resources, skill development, etc. Ninth one, information management system, IMS. IMS means they manage the every information centralized. For example, computerized hospital. In other words, paperless hospitals. The nurses can write the vital signs, mainly nursing chart, only available in the computer. No need paper to write. There's no need pen. Okay. That is a paperless hospital used to IMS in this information management system. The movement will be reduced from that, which means, for example, take on vital signs by the nurse in the ward. If doctors want to see that the detail about the patients, no need to walk or no need to call the nurse. Just type the name or the client number. Okay. Nurse, the doctors can see the vital signs of a particular patient and order or prescribe the medicine within their OP or IP where the doctors are living or working there. So these are the 10 standards prescribed by National Accreditation Board for Hospitals and Healthcare Providers. So this is the main topics, and subtopics are available, which will be detailed in the nursing management as well as in 4th year. So this culture aspect only we need to think about. Next, look at this, one of the picture available here, patient harmed. Systematic problem that harm patients. Look at this. The relationships is that bread and cheese. breadth means every systems of the hospital. Then culture, look at this. According to this picture, the culture is fundamental for the hospital. If culture is not standard, the culture of the particular unit of hospital is not standard, whole system of this hospital will be affected. Culture means behavior, behavior of the very professionals should be concerned in every department. If any one of the system affected, culture is not quality, all other system will be affected. So students, when you go to hospitals in the posting, just think about what about our hospital culture, how to improve. Just think about what are the material we have been using and how to improve knowledge regarding skill development, etc. Then importance of study of culture in nursing. Already we have discussed in every section what are the importance of culture in nursing. First important is that assessment. Nurse should be assess the culture of the client. Culture of the client. So that assessment, when you culture assess, we can identify diagnosis, nursing diagnosis, which means we can diagnosis or identify needs of the client, whether they are physical needs and psychological needs, material needs, we can identify. Then care, cultural oriented care. Fourth one, treatment. Culture is a medicine, already we have discussed. Cultural modifications, alteration of culture, cross-cultural studies help to cure the disease. Then prevention. Prevent communicable as well as non-communicable diseases. I was given various clarifications. Then promotion. Promote physical health, mental health and social well-being. Then prognosis. And find the issues, real issues earlier and provide interventions. The nursing management. Hospital management, hospital culture, we think about hospital management and nursing educational management. Then disease management in clinical aspect, disease management, the study of culture is essential in nursing. The nursing education, nurse as an educator should be think about culture of the every students. Every student having different culture, as we know that different material using, different type of pen, different type of papers, and having different knowledge. So as a nurse, as an educator, should be assessed. Culture of the each students, how they behave. Any behavior which is caused to restrict the learning activities as well as solve various student problems. Some students may be dull in the college or the learning. So nobody is, according to my professions, nobody is dull. Everybody perfect in one aspect or other aspect. Some issues may have in. So some students maybe do not use proper pen or papers, material aspect. As a nurse, as educated should be advised to student nurses and enrich learning environment and learning culture in the educational setting. 10th one, health educator. Health education mainly client concern, individual educate to individual patients, family health education, groups education to group, as well as school health education, etc. 11th one, counseling. Nurse as a counselor should be concerning assess the culture of the counseling or culture of the client. We should be give cultural oriented guidance. 12th one, nursing research. This knowledge is very important for research, problem formulation, research, design, as well as data collection, sample determination, mainly tool formulation, tool for questionnaire for formulation, then data analysis and interpretation. Different types of comparative study, different type of cultural background, what are the differences. The study of culture is fundamental in nursing research. Then all nursing discipline utilize this knowledge. Maternal health nursing, medical surgical nursing, pediatric, mental health, community health nursing. When you read, for example, Brunner, medical surgical nursing, do you know that book? When you read that books, we can see the words culture. Every disease started from cultural studies. Which type of culture caused a particular disease? The treatment is that cultural modification. Drugs only control the diseases. As this year we have pharmacology, we will learn about that. Maximum of drugs, there is no treatment, cannot cure the disease, only control the disease. But social medicine only can cure it. For just example, a blood pressure is a chronic illness, never cure by medicines. Lot of medicine available, drugs available, pharmacological, which is change the chemistry of our body and control the intensity of the blood pressure. But how to cure? Change culture, change food habits, change the behavior by alteration of materials we have been using everyday life, alteration of materials we have been using everyday life, as well change our belief, promote positiveness. So these are the matters, positive lifestyles. So these are the cultural components can help us to cure just blood pressure. So this is example only, just as well as all other diseases, including communicable diseases, can be prevented as well as cured by the cultural medicines. As maternal health as well as we can use culture for happier motherhood, and medical, surgical, pediatric with different types of diseases among the child can be cured by the cultural medicine and managed by cultural medicine. And mental health nursing, various types of mental illness can be managed by cultural oriented therapies. Then community health nursing. When you go to community, what will you do? Assess. First, assess the culture of the particular community, their family members in the community, and identify which culture is harmful to people, harmful to a particular family. Nurse advised to educate that nurse, educate the families and community groups to prevent the diseases as well as promote health, build healthier community and society. Then conclusion, hence concepts such as, what are the concepts learned? Culture, nature of culture, cultural medicines, affect or influence health status of people. Already we have discussed. This is conclusion. Then social medicine, already we had vast discussion I was given, explanation I was given. Then apply to nursing in every aspect of nursing: care, cure, prevention, promotion, rehabilitation. Then solve the problems. We need to think about healthcare problems as well as other social problems we can solve by cultural studies, including poverty, unemployment, illiteracy, climate, global warming, and the environmental factors. These issues as well as we can solve by cultural modifications. Mainly promote sustainable peace and development. The knowledge is very important for us to promote sustainability. United Nations set the 17 Sustainable Development Goals only achieved by cultural modifications or cultural enrichment. That's why we can say that we are nursing professionals, cultural medicine. We can diagnose, prevent, promote the diseases, and cure, sustainable treatment for various diseases. Then review question will be next class. Okay. Students, next class I will be next class I will be I think 9:30 tomorrow, or 9:30 to 10 I will be arranged next tomorrow will be. So I have to plan is that my plan about try to finish all these areas to, that's why I have to ask to 4 hours every week, Monday and Tuesday, Friday and Saturday. Monday, Tuesday, Friday, Saturday every week. Okay? Blessy?
Okay, sir.
Okay, thank you. Daya?
Okay.
Yes, yes. So I would like to ask one question regarding today's discussion. Aswini or Aswini? Ashwini or Vinisha? Vinisha,
Yes, sir.
can you list what are
Yes,
the
sir.
yes? Can you list? Question is that list patient center cultural standards. Read out in the screen available that in the screen and see and read. Yes.
Access, assessment, and the continuity of care,
Yes.
care of patient,
Yes.
management of medication,
Excellent.
patient rights and education,
Yes.
hospital infection.
Infection control. Okay, thank you, Vinisha. Wonderful answer.
Thank you, sir.
Any more clarification? Jeffrey Shaija, do you have any more clarifications?
No, sir.
Okay, thank you. Okay, students, thank you, everyone. Have a wonderful day.